necessarily understanding the impact of dementia on perhaps all of those things. And so training is very important. The Affordable Care Act does begin to address some of the issues that people brought up. Just this past July, internists now are going to be paid more under the Affordable Care Act. And also, the Affordable Care Act is going to begin to look at outcomes of care, not just paying physicians for interventions. And so when we begin to look holistically at a person rather than just how many tests can we give them, we will begin to see different outcomes. And I think, you know, the Affordable Care Act is headed in that direction, but there is a lot more that needs to be done, I believe, with training and education for internists and family practitioners.
Amen. As a friend of mine and I were having coffee, trying to solve the physician problem that he had. He learns that his wife has Alzheimer's. He now is walking out the office of the doctor feeling completely lost, confused, and did not know where to go. Our simple solution was that Cheryl get everybody in Mentor, somehow all the doctors, one of those helpline cards, or in other words, have something document at the doctor's office that says, here, take this. Call the Alzheimer's Association, do the following, and you know, something that just sort of informs people, because I'm sure many of you know a lot now, but the first time you got hit with it, you didn't know beans. And if somebody could just hand you a piece of paper, it would help. I know you can go to the internet, but you don't think that at the time. Just give the website address or the helpline. Just info at the doctor's office, and then as the funding comes, good.
I wanted to respond to your comment about medical students. Excuse me. And through the Cleveland Alzheimer's Association, I actually spoke to a group of medical students like 2 or 3 weeks ago, and another guy with early onset spoke to them the next day. So we are getting, you know, through the Alzheimer's Association, we are getting some medical students. But I personally had a PCP when I lived in Pittsburgh who had no clue what was wrong with me so young. He was shocked. I mean, he still calls me because he's shocked that it could happen to someone. And my new PCP here, she was so cute, you know, she's got a nice diamond young girl. I'm her only patient with Alzheimer's. She has not offered me any particular assistance. She has no training. She thinks she took care of one patient when she was in medical school with it. So that's just unacceptable. This disease is going to be, I had to write stuff down, it's going to be an epidemic. And somebody here that knows numbers better than I will tell you the numbers, but it is going to be an epidemic. If you don't have Alzheimer's, you'll be a caregiver of Alzheimer's. And the numbers are just unbelievable. And somebody help me out here from
5.4 million Americans have Alzheimer's today, and they're predicting by the year 2050 that number will be 16 million. 1 person out of 8 over the age of 65 and 1 out of 2 over the age of 85 have Alzheimer's today.
So, you know, I used to teach college, and I spoke to my students about the AIDS epidemic that we had just heard, and we had to wear gloves because we had to avoid blood, and we'd never done that before. And I was telling my medical director, said, don't worry, this is not going to be a big thing, it's just a little scare. Well, what an epidemic we had, and what money went into that, and how these people are living a good life now. Same with breast cancer, but we have to do that for Alzheimer's. I really like you guys that work for the government and have these people to do it while I'm still alive and while I still have some brain cells, okay?
I wanted to make a brief comment following up on some of the issues about reimbursement for care in the doctor's office and other, other venues, hospitals, and so on. A thing that we run into, and I'm kind of affiliated with UH, and we talked about this a lot, is that it's not just the person with Alzheimer's who needs to be thought of as the patient. Somehow or other, it needs to be a family sort of thing. And what I hear often from clinicians is that they really can't treat the family member. So they recognize the phrase we often use, the hidden patient. You know, that family member who's providing the care may be totally stressed, worn out, depressed, whatever the other issues are, but there's not a way to include them and get reimbursement within that same visit, which really should be a family visit, for that care. So I think when we're talking about creative solutions to financing the care, that somehow the family piece of it has to be a part of it.
I'm Doris Reich, and I'd like to piggyback along the lines of the training for doctors, particularly in this area. I would like to encourage more training and use of nursing, of your advanced practice nurses in this particular field. There are many, many that are excellent, and they're getting excellent training right here in Cleveland. And if they could somehow be encouraged, or the doctors could be encouraged to partner with them to give, like I've been in the hospital setting already where I have seen physician's assistants or advanced practice nurses work with surgical patients before and after, teaching, advocating, explaining, giving that extra care that the doctors themselves can't have the time to do, don't have the time to do. If there could be more of that kind of thing, perhaps then there could be more of the area of referrals to the Alzheimer's Association and to the Council on Aging, to other areas of advocacy. Perhaps then there could be more time given to tell family members ahead of time, encouraging them to write down the symptoms early so that the doctor can review this ahead, or that this can be looked at in advance. And then when the diagnosis is made, talk about some options, or talk about some of the potential for care that could be given without them just leaving the office with their mind in a whirl. This would be something that I think would add a tremendous dimension.
I have a question for the doctors here in the office or the research. So you talked about the fact that they isolated a gene for your wife, right? Well, if you have a history of Alzheimer's or Alzheimer-like diseases in your family, why can't you test a gene when you're young to see if that's something that you have, so that you can start preventative medicine?
But there's no known prevention, so we don't have a real solid handle on exactly what would prevent it, even if we knew somebody was going to be having it.
Maybe I can just speak to this a little bit. So there's early onset Alzheimer's disease, which is about 1% sort of all Alzheimer's disease. So they are fairly rare. The sort of late onset form has a totally different genetics. So meaning that in terms of the family inheritance patterns, it's very different. In the early onset cases, usually you can follow it from one generation to the next, and usually about 50% of the people in each generation are affected. But the sort of late onset Alzheimer's disease, which is sort of the more typical form, we now know some of the genetic factors, but there's no clear one Alzheimer's gene. It seems like there's a number of different risk factors, and actually very recently we've identified several of those over the past just few months. So I think that's still growing, but right now we don't have something that sort of say we can have a test that will sort of say definitively, yes, you are going to develop the disease and what time you're going to develop the disease, except in the case of the early onset.
In terms of awareness and getting more attention drawn to the potential explosion of persons developing Alzheimer's in the next, let's say, 20 to 30 years, I think perhaps the Alzheimer's Association, in terms of the national organization, might need to do something that some of the other diseases have been able to do, and that is to get high-profile people to come out in support or acknowledge that they have the disease. If anybody remembers, the late Elizabeth Taylor came out in support of getting funding for AIDS, and she was before Congress, and she was before organizations that help to fund research and help for AIDS. In recent times, we've had a president who acknowledged he had Alzheimer's. And we've had, most recently, Glenn Campbell came out, he has Alzheimer's. And Peter Falk, who died recently, also died as a result of Alzheimer's, and now we have an award-winning, I think, college coach who's just come out. I think somehow we need to try to get people to come out to Congress and before the Senate and the House of Representatives and talk about the impact that it has had on them and the impact it will have on the rest of this country if we don't get enough funding to help support research and whatever else that needs to be done. So I'm hoping that somehow we will get these high-profile people to help bring attention to the problem that we will be facing that will be horrific if something isn't done fairly soon.
Hi, my name is Danielle Morris, and I myself was a young caregiver. I think, in most part, tapping into the younger generation, and when I say younger generation, I think of high schoolers at this moment in time. They're the ones that see either their parent or their grandparent going through this process. And for them, sometimes, it can be very scary. So I think by tapping into them first, will prepare generations to come for the effects of this disease, to release them of being so scared to wonder, why is it that grandma started cursing? She never did that before. Why does she not want to get dressed in the morning? That's not her. Why doesn't she drive me to McDonald's anymore? And I'm thinking about the things that I myself thought about when I was a caregiver at 25, trying to get an undergrad degree, trying to work full-time, and 5 years from that, taking care of a father who passed from pancreatic cancer. So taking care of two people at one time and being ignorant of the things that were to come scared me to death. So I think that starting in the schools, again, with educating, providing the right resources, as mentioned at the doctor's office, when family members find out about the disease or the diagnosis, they're like, well, what happens next? There's not enough information, or as Rose mentioned, there's not enough public knowledge by a lot of higher up people that bring about change. So we have a new saying is that, why is it that I walk? I walk because. I am an advocate because. There needs to be an increased amount of awareness because of someone else's effect or cause to get us started. And I think that's where things start.
Hi, I'm Doreen. I work for the Alzheimer's Association. In my 24 years in another area too, working with Alzheimer's, families still are afraid to use the word Alzheimer's. They use other words. We used to use the C word for cancer, but now we use the word cancer. So somehow doctors, healthcare professionals, that word needs to be out more, and it doesn't need to be such a bad word that people are so afraid of it. We just need to get it out there more, and whether, like I say, it's doctors or healthcare people. And I think doctors need to really, and I guess because of the time element and bottom line money, that they need to just get face to face with their person and talk about this disease with their person. And then maybe even write it down, because they're going to forget about it when they get back. So the families could have that to reiterate.
You know, I don't think, I believe there still is a stigma. I don't believe it's a stigma that there was years ago. I know when my father was diagnosed in the late 80s, I didn't know what Alzheimer's was. I had to go get a book and start reading about it, and there was no internet at the time. But just to switch now to this question of doctors, and I've talked to friends who are physicians about this, and the problem they describe to me is the insurance companies and the government, if it's Medicare or Medicaid, are telling them basically how much time they have for whatever the procedure is, the office visit or whatever it is. I think we need to start telling the insurance companies and the government that regulates the insurance companies and the Medicare and the Medicaid, they have to build into the system a billing code that says talking to the patient about the results and giving them time to do that. That's the problem. I mean, I see this in the non-Alzheimer area. You know, if any of you have aging parents and you take them to the doctor for anything, we're a society now that has a separate physician for every piece of our body. And it seems that nobody has time to talk to anybody else, and unless